Hello, Facebook friends. It's Carla, your online doctor, with today's Live in 5. Today is Thursday, April 25th. It is 5:05 p.m. So I hope you're finding these talks on traditional Chinese medicine fascinating. Hey, Kim. It's so different from Western medicine. Your mind has to be open, though, to learning new things. Okay, because if we're stuck in what we know, we can't be open, obviously, to anything that we don't know. So we have to really allow our minds to go someplace outside of our, like even outside your comfort zone, if you want to think of it that way. Hey, Ina, how are you? Okay, so today we are talking about the traditional Chinese medicine massage technique called Tui Na. Okay, it's spelled T-U-I-N-A, Tui Na. Now, it literally means to pinch and pull. That doesn't sound too appealing, but unlike traditional massage in the United States, Tui Na is not generally used for pleasure or relaxation. Okay, but rather as a treatment to address specific patterns of disharmony. Now, practitioners of this massage will use it for many of the same reasons as acupuncture. Now, Tui Na is used to harmonize yin and yang by manipulating the qi in the acupuncture channels that we talked about, the meridians. Tui Na includes what is known as acupressure, where people use fingers to apply pressure instead of needles to the acupuncture points. Okay, so like I said, unlike American massage or, what we consider, I'm going for a massage, I need to relax, my muscles are so tight. It's not that same type of technique. Now, Tui Na massage sessions usually last between 30 and 60 minutes. Some techniques are similar to ones used in Swedish massage, such as gliding, kneading, rocking, pulling, friction, and rolling. Unlike Western massage, Tui Na goes beyond the muscles, bones, and joints to work with the body on a deeper energetic level. Now, Tui Na practitioners intend to sense the energy of the client with their hands and affect the flow of that energy during the session. Okay, so just like these meridians where these experts say they can feel the flow of energy through these meridians, these Tui Na practitioners want to feel that energy flow in the person they are working on. Now, this technique is done while the patient is fully clothed. So they recommend you wear loose, comfortable clothing so the practitioner can actually move your joints through the full range of motion. So it's not something like here where you take off everything, lie down, they cover a towel over certain areas. It's not that way at all. Hey, Vicky, how are you? Okay, so in alternative medicine, Tui Na is said to aid in the treatment of arthritis, back and neck pain, carpal tunnel syndrome, chronic fatigue syndrome, fibromyalgia, headache, insomnia, menstrual cramps, and sciatica. Okay, that's a lot of options there and a lot of things people suffer with every single day. Now, it is also used to relieve stress and anxiety. Okay, well, that covers everybody, I think. Okay, studies have been done showing promise in its use. A study done in 2010 in China divided patients into 3 groups. All of them had chronic fatigue. One group underwent Tui Na, one group had practiced Tai Chi, and the third group received Prozac, an antidepressant, often used to treat chronic fatigue syndrome. Now, after 1 month, the Tui Na group showed the greatest improvement in free radical metabolism, which is one measure of decreasing fatigue, which is pretty interesting because, why not prescription medication? You would think that that would be the best, but as I've talked about, and many of you understand, that the majority of medications treat symptoms, not the root cause. So you're only masking a process or a disease event, a situation happening in your body. You're not actually getting rid of it. with the exception of antibiotics or something like that. You're just masking the symptoms. So the Prozac group didn't do as well as you would think. Now, multiple other small studies show benefits of using Tui Na in combination with other modalities, including acupuncture, yoga, and Chinese herbs. Now, as with anything I've mentioned in all the time that I'm doing my talks, especially if you're taking medications or have any health conditions, consult your personal medical physician before adding anything like this to your healthcare routine. Not because it's dangerous, not because it's risky, but because you want the doctor aware, especially if you have arthritis or any type of condition which you would want them aware of. The practitioner who you go to see, the traditional Chinese medicine practitioner, should also be made well aware of any limitations you have in mobility, etc., so that they maintain your safety along the way. So I hope that is a little bit of help for you guys. Like I said, I'm loving this, and I'm having some people interact with me telling me that they're starting to incorporate some of these techniques in their healthcare routine. I love it. So please share with me some more. Let me know if you've ever even heard of this. I'd never heard of Tui Na before. So this was totally, I mean, I've heard of acupressure, but I'd never heard of this specifically. So I'm learning too. So I hope you guys are enjoying it. And that's it for today. I will see you again tomorrow for another Live in 5.